Welcome to the Megan Claire Show. I'm a breast cancer survivor, patient advocate, and your host, Megan Claire Chase. I am working with Ancora.ai to help share their mission, which is to give unbiased and comprehensive information for patients to empower and bring vetted clinical trial options for all patients. Now, I am so excited to introduce you to our special guest, Luca Jahreiss. Hello, Luca.
Hi, Megan Claire.
So Luca is one of the co-founders and the medical lead on Ancora. He has a PhD in medical genetics from the University of Cambridge. Y'all, he's smart. Since then, he has been working in healthcare for more than a decade with increasing focus on oncology, specifically personalized medicine. So we're going to talk about genetic testing. Luca, what is it?
Very good question, Megan Claire. Obviously, I mean, the first thing to notice is that cancer is really at its heart a genetic disease. It's not a simple genetic disease like, I don't know, Huntington's, where you have one specific gene that is mutated and then it's very clear what happens. Mm-hmm. But you have a wide variety of genes that could change. But what they have in common is they drive the behavior of our cells. And so really genetic testing is a diagnostic tool to better understand the tumor that the specific person has.
Right.
And I think it's important also to differentiate between two types of gene changes that people are interested in. One is more inherited ones, and the other is acquired ones.
Oh.
Maybe to explain a bit more what that means.
Yes, please.
I mean, the inherited ones is really more what you got through your family, let's say. Mm-hmm. And what's important to understand what your risk is, or someone in your family's risk is to develop cancer, whether now or in the future, versus the acquired ones, which happened later down the line. So it's more specific to you and has nothing to do with your family per se. And really is what probably is more relevant to understand what treatment might be the best one. Obviously, the inherited ones can be relevant as well, but so that's a kind of a different perspective on the same thing, I would say.
Yeah, I never really thought about that. Like, we always hear more about what's hereditary, and getting testing for that. Like, I never really thought about like my own genes, and what they would show. That's like just for me.
Yeah, exactly. I mean, if you think of breast cancer as an example, I mean, a lot of people are aware of BRCA1, which is more an inherited gene usually. I mean, that's when you look at it, because like, oh, your mother had a mutation, or you're worried that your children might have it, or your niece might have it, or someone. Versus, I would say, HER2, for example, which is more classic example of more acquired one, which is more important to then determine the treatment if you have been diagnosed with cancer. So the situation is slightly different, but in the end, they're both gene changes. It's just a different way to look at it.
Can you explain really quick about unknown variances? I know a lot of us in the cancer community, whether it be breast, whatever, some of us have like this unknown variance, and we get really confused when we hear that term. Like, what does that mean?
Yeah, unknown variances normally means that there's not been any research showing what effect this gene change has, really. So it's clear that it's different than what most people have, but it's unclear what the effect is. It might not have any effect, or it might be very important for your cancer. But obviously, until you have more research out there, it's hard to determine. But that's also why it's important to kind of continuously assess also what this means. So even if you have a report this year, you can check back next year and look into it again, and it might have changed. They might have figured out that this leads to the same effect as a much more better known variant. So continuously changes.
I mean, I always knew I was special and a mutant, So when they told me that, I was like, what do you mean you don't know what this is? So that was like when I initially got diagnosed, that was one of the first things I heard. I was like, what? So, Luca, tell us who should consider genetic testing?
Yeah, so I mean, as I pointed out a bit earlier, I mean, the reason why you would want to have genetic testing varies to some extent. So it's hard to give a very general answer. So there might be a specific reason that you want to understand the risk in your family or the risk for yourself to develop cancer. And then obviously you want to probably want to do it as early as possible. Although probably then there's more discussions in terms of if there is a result, how do you talk about this with your family? And you might have to involve a genetic counselor and those kind of aspects. So then timing is obviously slightly different. The other aspect is, while you have been diagnosed with cancer and you want to better understand what the right treatment could be, or you and your oncologist want to better understand what the right treatment could be, and then it depends what stage you're at and what the next step would be. So obviously, if it's already clear that you should have surgery, you probably want to do your surgery first and then reassess. But it might also be earlier than that. And I think also depending on that, there are different types of tests available. If you're very clear that you want to test whether you have a risk and you know that in your family have BRCA1 mutations before, you might well only test for that one. But then there's also broader panels where you can test like 30 genes that are known to be involved in colorectal cancer, for example.
Oh.
And then to the extreme, you could sequence your whole genome as well, which is not commonly done nowadays because, as you pointed out, a lot of things are unknown. So most people normally focus on the genes that are very clearly involved because otherwise it's hard to do anything, action it at all. I mean,
right.
Of course, you might find lots of variants that could be involved, but if you can't do anything about it, it's also not that useful in the end.
True.
At this point in time.
So, like, say you're like, for me, I am officially 5 years Ned. I actually just talked with my breast cancer surgeon, and she suggested that I get genetic testing again because there's been a 5 year, time frame since I last had it. Is that something that cancer patients should think about if they've reached a certain point in their survivorship stage? Should they think about getting tested again, but with a broader panel?
Yeah, of course. I mean, especially in the last few years, there's been a lot of research done into this, and tests have become a lot more specific and also broader. So there's definitely more changes you could see and also assess, analyze properly, I would say. I think, especially on the analysis side, a lot has changed, and they have a lot more research in the background to support what this could mean.
Ooh.
So, I mean, there could be interesting new insights. Maybe your variant isn't unknown anymore. I mean, there might be at least early research showing that it has some kind of effect.
Yeah, I definitely am going to call the genetic center and talk with another genetic counselor and see what we can do because I feel it's important. I want to know what all is in here.
Yeah, and I mean, it's very specific to you, right? I mean, it's not like other diseases where there's like one mutation and this is the mutation defines this disease. It's like everybody has very specific set of gene changes that leads to their cancer. So
Luca, how does genetic testing impact treatment options and trials? I know we've already alluded to it a little earlier about the treatments, but how does that impact both treatments and trials?
yeah, I mean, I think you alluded in my introduction, so I focus more and more on personalized medicine. And I think that's the important point, that a lot of treatments are becoming more specific. Whereas, I mean, for example, that chemo, for example, is fairly non-specific. I mean, it kills all dividing cells, and that's why you have impact on your hair growth and a lot of other things. And then a lot of drugs are just targeting breast cancer in general, for example, at the moment, or colorectal cancer, metastatic colorectal cancer. Whereas where the development is going is that you're becoming more specific in what the treatments are targeting. And it's not just breast cancer, or the origin actually of the tumor becomes less important. It's more important what the characteristics are. So what the gene changes are specifically. And so you might not say anymore like, oh, it's HER2 positive breast cancer, but you might just say, oh, it's a HER2 positive solid tumor, for example.
Oh.
And that's also why it's becoming more important to really characterize your tumor specifically, so that you can then assess like, well, is there a treatment out there already that could target this? And also, if there isn't yet, is there something in development? So is there a trial where that could really target my tumor specifically?
So when patients are looking for clinical trials, do they have to know what their, do they have to have that genetic testing, have that information in order to look for trials? How would a patient know what to focus on when searching for a trial?
Yeah, so that varies. I mean, we have seen some trials where it's literally about testing the people first in the trial and then finding the right treatment out of all the treatments available. But often it's the case that you already have to have a test or have some indication already for a trial. And so you would have to have that information. And so it's definitely important to have that, to get that information from your oncologist as well.
Okay.
At least the ones that are most relevant. And so that's also how at Ancora we've been working, that in the questionnaires that we have for each cancer, we already included the most common gene changes that occur. So for breast cancer, for example, HER2 and ER and so on. But then we're also working on increasing the number of gene changes included to a few dozen that we're currently working on, so that you really have the chance of also finding trials that might be more out there that you might not think about, and your oncologist might not have heard about either. Because they're obviously not specific to your cancer, but you might just say, oh, this is a solid tumor trial for this specific mutation that isn't that common. But obviously, it's not important if it's common in the general population, in the whole cancer population.
Mhm.
It's important if it's if your cancer has it. And
Interesting.
so it is relevant to understanding, and that's why we also want to improve on that and really make it available, because we've seen, like I'd say, over 100 genes already in the trials that we've looked at that are already covered by some trial or the other. So
Wow.
so
So
we're also surprised about that, because normally you always see the same ones, and you're like, oh, see, for a specific cancer, you see the 2 or 3 mutations, always the same ones that are focused, that people focus on, but it's really broadening.
So tell me this, as we wrap up here, like what should patients consider, and also like what are some things they should say to their physician to say, look, I want to get genetic testing, especially for those cancers where it's not breast, where that's all common, where there's the BRCA gene, but it's like the other, I guess, less common types of cancers. How can patients talk with their physicians to say, look, this is what I want, and this is what I need, and this is my reason why?
Yeah, I think the important thing there is to just make it clear for them. I think a lot of oncologists would also be supportive of that, but to make it clear that you want to have the right treatment for your specific cancer. And I think, obviously, to some extent, also, the more specific your treatment is, the more likely you have an effect on your cancer, and the less likely you are to have side effects to some extent as well. Obviously, that's not a given, but at least that there's a higher likelihood of that. And so, and also making it clear that there are a lot of treatments approved for some cancers that are not in others. And so there is already, even outside, besides trials as well, there's already a lot of treatments out there that might start being tested as well in other cancers. And so it's important to know that what your characteristics are, rather than to be like, oh, we just start chemo and we'll see later.
Right, just kill everything now, and yeah.
Exactly.
Well, Luca, I mean, this is like mind boggling. And I feel like we could seriously go on and on again. So you will be back because definitely I'm sure as things keep changing, I guess, in this world of genetics or more is being known, I think it's important for patients to really understand how important genetics are to their health.
Yeah, exactly. I mean, it's much broader than just like, oh, I need to find these three mutations, really understand my treatment. It's much broader than that. Exactly.
Yes. Well, thank you so much for joining me today, Luca. It has been a pleasure. I mean, y'all, he's brilliant, right, y'all? He's brilliant. So, if you have any other questions regarding, genetic testing or looking at Ancora, seeing what type of trials there are, make sure to check out the resources at Ancora.ai, where they humanize clinical trials. And don't forget, follow us on social media. We are, of course, here on YouTube, so subscribe to our channel, but we're also on Facebook, Instagram, and Twitter. And as always, if you have any questions or want us to cover something in particular, leave a comment below or email us. I am Megan Claire Chase. And remember, the more you know, the more empowered you will be.